Good morning. Welcome to Sports Radio 1310 The Ticket. George D. John on the Train Station Fitness Show. Two guests in the studio today. One you've known very well, Dr. Jeremy Webster. Good morning, sir.
Good morning, George.
And also Dr. Kevin Light. I thank you for being here today. Let me just give a little background about who you are and add some credibility to you, your name, your profession, being on the show. You were trained in traditional medicine. Dr. Light has over 25 years of surgical experience, specialty training in general and trauma surgery. In Dallas, Texas, he's known as the TNA man, and everything that applies. He gives you the boobs, he gives you the butt. A lot of girls want the Brazilian butt. Well, you can get it with Dr. Light. He was in the Air Force as a general and trauma surgeon, flown all over the world for 7 years, has a couple of commendation medals. He flew F-15, F-16 fighters or fighter squadrons, and also was the chief of surgery in his deployment in Saudi Arabia during the Gulf War. Dr. Light was trained in traditional medicine, and 5 years ago, he said, George, if you came up to me with the information that you talk about on your show or Dr. Webster talks about, I would have turned and walked the other way and thought you were absolutely nuts. Now, he's critical of many of the traditional medical practices of our time and is an enthusiastic advocate and practitioner of functional medicine. So, share that with us if you would. You were like every other doctor, and what made you change your mind? You don't have to talk about functional medicine right now, but what was that light bulb moment that said, something's not right here?
Well, yeah, it was a combination of things, but as a surgeon, as a general surgeon, it tends to be a very invasive profession. And we were doing a lot of surgeries which were just the prophecy of the day, gallbladder surgery, ulcer surgery, which are very invasive for problems that were sort of nondescript.
Yeah.
And that sort of got to me after a while. And then finally I got into aesthetic medicine, and I started to notice that you'll have a 60-year-old and a 30-year-old, that maybe you'll have a 60-year-old with nice, smooth white skin and a 30-year-old with leather skin. And one ages at a different rate than the other, and I'm wondering, what is it about people and their lifestyles that make them age? And why is this person healthy at 60 and this person's a mess at 35? And it got me started thinking about medicine and the influence of lifestyle and diet and habits into the way we live, and the fact that medicine, as we know it, doesn't address that at all.
So what you're saying is medicine was not doing the job that you thought it was doing at the time?
Correct.
All right, or you were educated to think it was going to do, like the girls who came in your office with big boobs and said, "Hey, try this next medicine because it's this and this and this."
Well, the way we're educated is it's sort of an algorithm approach. You have your 5 minutes to see a patient, and then you make a snap decision, and I fit you into a pigeonhole, and then I do one of two things: I operate you, or I give you drug X. That's the way we're programmed to think and treat patients, and then I get you out of the office and stamp next case. And so medicine, what they were ignoring was the huge impact of environmental toxins, the huge impact of diet in your lifestyle, of stress,
right,
of all the other things.
All right, so coming up next, what I want you to do is I want you to share all of the great nutritional training that you received in medical school as a traditional practicing doctor, medical doctor. I want you to share all the incredibly great nutritional medication or training that you've gotten with everybody listening to the show today. So we'll talk about that coming up next. 704 Sports Radio 1310 The Ticket.
Roles reversed. Broncos break the Cowboys.
711 Sports Radio 1310 The Ticket. George D. John on the Train Station Fitness Show. Guest in the studio is Dr. Jeremy Webster and also Dr. Kevin Light. Dr. Kevin Light is a medical doctor, and he's a trauma and general surgeon. He also does boobs and butts and all that other good stuff. He's very qualified. He's been a surgeon for the past 25 years. And, you know, it's good that we have a medical doctor on the show who has a different approach or a different thought to how he was traditionally trained. So the question I left you with, Dr. Light, and if you want to go to his website to read more about him, it's TIFM.com, which stands for Texas Institute of Functional Medicine. So TIF as in Frank, M as in Mary.com. The question I left you with this, or the thought, please share with everyone all of the incredibly great nutritional information that you received as a medical doctor, traditionally trained medical doctor, that all medical doctors receive, unless I'm wrong, with everybody listening.
George, I would have to say that it was probably the best 2 hours, or one of the best 2 hour sessions I had in medical school.
Best 2 hour sessions.
It was.
And you only had 10 hours of medical school, right? So, so it's not bad.
That's right. That's right.
Per day. Yeah.
Per day, yeah, right. So literally 2 hours worth of nutritional
I would
training.
guess about 2 hours. Yeah.
Now, this isn't 2 hours of an entire semester, right?
No, 2 hours total. I mean,
2 hours total.
Nutrition was. Oh, and by the way, in passing, nutrition is what nutritionists do. Doctors, we're too busy for nutrition. You see.
Right. Now, Dr. Light, tell me, is nutrition important? Does nutrition have any kind of play on the way the human body works?
Your nutritional intake is the most powerful drug, the most powerful manipulator of your genes. It's the most influential, impactful thing you can do in your entire life, without question.
All right, so now, since I was wrong on the first one, let's see if I'm going to be wrong on the second one. I want you to share with everybody all of the incredible information you received about how the environment influences our body and lifestyle, and how it affects disease and illness.
George, I can't treat lifestyle and environment with a medication. I don't have time. It's not in my textbooks or my algorithms. We got zero training on environment.
So I was wrong again? You didn't have great, incredible training about the environment and lifestyle on the body?
You're batting 0 for 2, George.
Zero.
So everything we're getting exposed to, everything we put in our mouth, those aren't things that medicine considers important as far as the health of the human body.
Well, you have to understand what medicine came from. Medicine is highly influenced by drug companies, big pharma, and as well, medicine is highly influenced by food manufacturers. Now, if I can't sell you a cholesterol-free food, if I can't sell you a drug to fix your symptom, then there's no money in it for me.
So then, am I wrong on this one also? Because this is the one I feel like I'm right on. You've got to tell us about all the great information and beautiful pamphlets that drug companies give you with all the research that they've done, because they've done millions and billions of dollars worth of research that give peace of mind to your patients to help them feel safe.
Oh, we've got tons of research. Let's take antidepressants, for example. Antidepressants, one of the #1 drugs in the world, and it's very profitable. You have a crazy come into your office, you pop a little antidepressant pill, and you send them home because, bam, you've got 40 patients to see that day. I don't have time to be talking to you and your problems, so I give you a little pill and you're on your way. However, antidepressants, when you look at, there was just a new article, not new, it's a couple years old, in the New England Journal of Medicine, very respected journal, that mentioned the fact that drug companies will publish articles that will promote their drugs, and they will suppress or repress articles that show bad results. And so they skew the results. That's the results they show to the public. That's the results they show to the press. And that's the results they show to their patients.
So now you know this for a fact?
I know this for a fact. This is common knowledge. New England Journal of Medicine
came out.
Recently did this.
We also talked about it about a week or two ago, Dr. Webster and I. Business Week about a year and a half or 2 years ago, talking about that exact thing that you did with statin drugs, how certain information was omitted about statin drugs. So then you, as a traditionally trained doctor, let's see if I can get this one right, must get incredibly great incentive to consider alternative approaches to care.
We have absolutely no incentive at all. Think of the business model today. You take your standard family practice doctor, for example. You've got the reimbursements for doctors are cut way down. So how do they make up their money? They do it through volume. I've got 5 minutes to look at you, figure out your problem, and get you out of my office. And especially if I want to build the insurance company. So it's a volume-based business now. And the way I was trained in medical school is I make a diagnosis and I find the quick and easy fix. It's an algorithm. So I'm going to pop you a pill or put you into a surgeon's office and I'm done. Stamp, next case, let's move on.
So now one thing you told me when we met during the week, you said healthcare professionals are living in a compartmentalized and disease-centric approach as far as results in a population with an epidemic of obesity, diabetes, heart disease, and cancer in levels never seen before. What I have to say here, let's see if I'm right on this one, we have all these great medications now, and we're living longer, so you've got to be wrong.
Well, actually, we are living longer, but there's a lot of other countries who don't have our, quote, health machine who are living just as long and far more healthy.
I think, again, we're getting back to the way we looked at statistics.
Yeah.
Doc mentioned some of the ways that we can manipulate statistics to make antidepressants look a little bit better than they might be and suppress the side effects. so that they don't look as bad as they might be. The same can be said about statins, the way they look at absolute risk versus a different kind of risk based on statistics. Well, you're coming right back to what were we talking about?
Well, we're talking about heart disease being fixed or diabetes being fixed through medication, and we're living longer with these medications.
Yeah. Now, I'm sorry about that. I got sidetracked. But we can even look at length of lifespan and manipulate statistics to make it look like modern medicine is the reason. And a lot of this is just because of hygiene and certain things like babies aren't dying as much as they used to. So a baby that doesn't live 1 month but ends up living 70 years, that really skews the overall statistics of our average length of life. When people who live beyond 40 are really not living to an older age than they really used to be.
I have another answer for that as well. We have, you look at the statistics and it says, yes, our life expectancy is longer. However, as you mentioned, it's because more babies are living, so the average is going up. And another thing to understand is that we have an epidemic of chronic disease which we've never had before. Our heart disease, obesity, cancer is higher than it's ever been before. And the big argument that everybody has for that is, well, people used to die of infections and accidents, and they don't do that anymore. But in fact, if you look at the statistics of people who are dying, you take a healthy person in 65, who was 65 years old in 1850, and you take a 65-year-old healthy person now, and the life expectancy is pretty much the same. It's unchanged.
Yeah, that's what I was getting at. As long as they live to a certain age, they're going to live about
right. As long as a farm tractor doesn't fall on you, or as long as you don't get the plague, you're going to live as long then as you did today. However, today you see far more heart disease, cardiovascular disease, cancer, things that were almost unheard of 100 years ago. And why is that? Because we live in a cesspool of food, industrial toxins. We exhaust. Our water supply is terrible. Everything is.
So yeah, and I actually did a show on that with a guy named Lano Oahu out of Hawaii. He wrote a book called Don't Drink the Water and talked about how unbelievably bad our water filtration system is, that the pipes are so old, and the tap water is one of the worst things you can drink. So I agree with you. So I'm going to ask this questions for other medical doctors listening, because Dr. Webster and I got into a tiff, if you will, discussion with one that had called in at one time. And so my question to you is this, as if I'm a medical doctor and I'm being skeptical. Why should I believe you about what you're talking about with big pharma, medications not really being as good for us, food being our drug of choice to help us be in that homeostasis condition? Why should anybody listen to you?
Well, you don't have to believe me. The information is everywhere. It's ubiquitous. It's out there. And I think what doctors today have to realize is that they've been scammed by drug companies. You got to realize the drug companies finance your education in many ways. They pay big money to the AMA, to your organizations. They finance all the research that's going on. And then you have the drug company reps who come into your office and basically say, this is the latest and greatest. If you want to be doing what your peers are doing, doctor, here's what you're going to do. And so you've got about 2 minutes to think about it, and bam, you're off to see the next patient. You go to these large conferences every year, and again, these are funded by big pharmacologic companies. So this information is out there, but you have to look under the radar. You have to look under the veneer of what's being pitched to you, because you're just being pitched. You're being sold like anybody else as a physician, and you're not above that just because you have an advanced degree.
So now, you're trained traditionally like every other medical doctor that's either listening or practices today. But you've gone outside of the box and you're doing more functional medicine. We'll get into that in a moment. I would think, let's see if I could be right on this one, that you're still prescribing 1 to 2% of your patients on statin drugs, aren't you?
Statin drugs are poison. Statin drugs are...
What do you mean they're poison?
Statin drugs are harmful.
Hold on. A Dr. Greg called in about 3 weeks ago and said he is in touch with the most professional, credible lipid doctors and researchers around the United States and said statin drugs are not dangerous for you. What are you talking about?
Dr. Greg, unfortunately, is just part of the herd. He's doing what he's been told. He doesn't know what he doesn't know.
I love you, Dr. Light. So,
and statin drugs, let me give you a little background.
Jeremy Webster, you're right.
The whole lipid hypothesis started in the 50s with a biochemist named Dr. Keyes. And this guy did a research study and it found out, and he had 22 countries. Now, Some of those countries, about a third of them, there was a correlation between high fat levels and heart disease. It's like driving by a house. You see the house is on fire. You see a fire truck in front of it, and your conclusion is, hey, fire trucks cause fires. Well, this guy saw these countries that had high fat and heart disease. He goes, hey, countries with high fat have increased heart disease. He ignored the countries that had high fat level intakes with no heart disease. He ignored the countries who have low fat intake levels, like Chile, with high heart disease. Didn't fit his model, but he did go on, publish a study, got on the cover of Time magazine. It was a beautiful thing.
Wow. You couldn't have said it better, Webster. Don't even try.
I've tried many times.
So hold on. This is just to do a little recap. We have traditionally medically trained Dr. Kevin Light on the show today. I know I just botched that up. Because I'm just flustered. I'm glad to have you here and many other medical doctors that I've had on the show before that have the same line of thinking, because you've gone outside of that narrow-minded thinking of how you were trained and recognize that what we're doing in America today is not working. There's got to be something bigger and better. You happen to have respect for a chiropractor today, because today's chiropractors have learned much more than just manipulation. They've learned an extensive background in nutrition. Dr. Jeremy Webster's here, and he can talk till the cows come home, and I can talk about certain things also. People are not going to believe us because we're not medical doctors. Having you on the show has added so much credibility today. Since you wanted to go and talk about statin drugs, I'd like to talk about them further, because here's a little confusing. This is a little confusion going forward. People take the information they've gotten from my show, whether it's just me or Webster or myself, and they bring it to their medical doctors. The medical doctors say, you know what? This guy doesn't know what the hell he's talking about. This guy could be dangerous for you.
George, I had a patient just the other day. He printed out a small write-up that I did on my website. It said simple things like cholesterol is the building block of sex hormones, testosterone and estrogen. Cholesterol is the building block of vitamin D. Cholesterol is the building block of bile salts to break down your fats and your food for digestion. And said maybe cholesterol might be important. And that was basically what the write-up was like. He sent it to his medical doctor, who wants him on statins, who, by the way, his cholesterol without statins is 196. He still wants the guy on statins. The medical doctor faxed back 100% incorrect about just my basic information that you can get at any physiology textbook.
We have to go to break, but before we do that, I think, and I'm going to speak for medical doctors because I don't know, I think they might say the information that people are getting is... you can get all this information on the internet where it's not necessarily truth, that anybody could make anything up. And that's why it's important to have Dr. Light here right now, who has done extensive research. He's traditionally trained, yet he's gone outside of that training. So since we're on this topic now, moving forward, I actually want to talk about it, and we need to really set the record straight with having you on the show. So coming up next, the cholesterol myth. Even if you don't have high cholesterol problems, you need to know this, because medical doctors may want to put you on cholesterol medication. I'm not the one saying it. Traditionally trained medical doctor, Dr. Kevin Light, is on the show saying it. Let's talk more with him coming up next. 726 Sports Radio 1310 The Ticket. 733 Sports Radio 1310 The Ticket. George D. John on the Train Station Fitness Show. Dr. Jeremy Webster and also Dr. Kevin Light is here. Dr. Kevin Light is a traditionally trained medical doctor. He's been talking today about all the things that he was not trained in medical school that I think we take advantage of when we go to a doctor thinking that they have all of the answers.
He's come over from the dark side.
He's come over from the dark side, baby.
Side.
So, and he's enlightening us now to a topic that's been so sticky on this show that I hope you've added lube to it. In that the plaque doesn't stick, it just goes right through the artery wall. Anyway, Webster, you mentioned something about the American Medical Association, what their influence is over medical doctors. Go ahead.
And this is just something that I want to know more from because of my curiosity. We're talking about statin drugs. We're talking about cholesterol, and we need to get into that in a little bit more detail. But what I want to know is how much control do the AMA guidelines have over your scope of practice as a medical doctor? Are you supposed to give a statin drug if someone comes in and their cholesterol is above a certain level?
The AMA doesn't really have much control over how you run your practice. They sponsor educational programs and they try to foster a general method of treating people.
But isn't there a protocol as a medical doctor that if someone has a specific level of cholesterol that you're supposed to?
That's conventional medical wisdom. There's no definite protocol. Now you have things called standard of care, which is more of a legal issue, which is something more that the Texas Medical Board will enforce. In other words, if someone has high cholesterol, you don't give them dried peaches. So there are certain things that you have to consider in the acceptable realm of medicine, but that's the problem. What's considered the acceptable realm of medicine is the guy. Okay, but you're really not. There's no pressure to practice one way or another in terms of the governing agencies. But there's more peer pressure and more legal pressure. A lot of the pressure that the docs have now is legal pressure.
So what do you say? You said you heard the show with Dr. Jeremy Webster and Dr. Greg, who were discussing back and forth it was like night and day, the issues that they were having with trying to get on board with each other's understanding, if you will, about cholesterol. Let's take statin drugs out of it for a moment. Just cholesterol, whether it's positive or negative, and studies saying that cholesterol couldn't be low enough as far as your numbers are concerned. Some medical doctors believe, and then others say cholesterol is not the factor. Cholesterol is your friend, producing all these hormones and all the other things that it's responsible for. Your stance as a medical doctor, you were traditionally trained to think one way. Now you think another way. What is the truth?
Well, I think we're still going to find out the truth. But in regards to all these other doctors and the mainstream medicine and their love for cholesterol drugs, people used to believe the earth was flat. And then, by God, and now it's round. They used to persecute people and burn them to the stake if you didn't follow a certain religion. Doctors used to bleed patients. That was state of the art at the time. And it took a while to talk these bleeding doctors out of doing that. And most recently, we've had doctors, the medical establishment, they were the ones pushing saturated fats and margarine, which turned out to be full of trans fats and very, very dangerous. And they go, oops, I guess we were wrong. It's the same thing with cholesterol. And cholesterol was something that came out of the 50s on shabby science. And then the big pharma guys said, hey, we got a drug that can bring down cholesterol. And yeah, there's an association between high cholesterol levels and heart disease, but there's no causality. There's no research that says cholesterol causes heart disease. In fact, we believe that if you have heart disease or other problems, cholesterol is in there trying to patch it up and try to save the day. And so cholesterol is a secondary bystander, not the cause. That's the way.
That's what you've said forever.
It's the same analogy Dr. Light already used. The fire is there, the fire department's showing up to put out the fire. Just because there's a direct correlation between the number of fires and the number of fire trucks at your house doesn't mean that the fire trucks cause the fire. Just like the police department is often around crimes. If you lock all the policemen up and don't allow them to go to the scene of the crimes, there's not going to be that correlation anymore, but that's not going to prevent the crimes.
Right. That's right. And cholesterol has many critical functions. All the important hormones in your body are cholesterol-based. And cholesterol also has a repair mechanism. So if you're going to damage your arteries and your vessels, your cholesterol is going to increase in an attempt to repair that. And then some scientist comes along and goes, hey, look at that. You have heart disease, and it's from that cholesterol. What we've really found is that cholesterol basically is there to try to put out the fire, as Dr. Webster was
saying. So the
saying.
argument that you heard with Dr. Greg and Webster, how would you comment on that? What would you say when Dr. Greg said, I am friends with or in touch with all of the latest lipid research scientists around the country, and he completely was against everything Dr. Webster had to say? Comment on that.
I would say he doesn't know what he doesn't know. There's a great book out by a doctor named Dr. Mark Hyman, MD, and it's called The Ultra Mind Solution. He also did Ultra Metabolism.
You know that?
It's well referenced, and you go to the back of his book, and it's got thousands of reference points on articles that would refute everything your physician last week said. And the problem is that the literature is everywhere out there. You just have to look a little deeper for it because it's not in the mainstream, because it's not promulgated and promoted by the drug companies, by our organizations which take drug company money, by our educational institutions. And so
let me interject for a moment. Someone listening to the show, let's say it's another medical doctor traditionally trained like you were, may say the information might be might be fueled or paid by, rather, sponsored by people who are against drug companies. Okay, so let's look for a moment at the people who are sponsoring the study and look at their motives. We know what Big Pharma's is. How do we know that the information that you have read in this book, the one also that Ufi Ravskov wrote, the cholesterol myths, how do we know the information is accurate? I already feel I know the answer to that, but how do we get that across to people listening? My father's on cholesterol medication right now. He's wanted to get off for a long time. He eats really well. He's done my cleanse program. He couldn't be healthier. Goes to the doctor. Doctor says, your son is full of crap, doesn't know what he's talking about. Oh, okay. I don't know what I'm talking about because I'm not a medical doctor. You're a medical doctor. How do we let people know the information you've read, Dr. Jeremy Webster has read, what I've read, is accurate and is safe, and to tell my parents and other people to go to another doctor?
Let me give you an example of that. Let me tell you about what we see in my clinic every day. We have people who come in, they say, Doc, I've been to 5 docs. And all they want to do is they want to give me a pill. But I still have headaches. I still can't sleep at night. I'm still gaining weight. I have no sex drive. My hair's falling out. I got muscle aches and muscle pains. And no one's been able to really come up with a solution. And you're the 4th guy. You're the 5th guy I've talked to. So we go through it and we start to dissect out what's wrong with this patient. Your hormones, they're completely out of whack. Your diet is awful. It's terrible. You have all this stress in your life. And so all these things sort of accumulate. These are things that doctors never look at. All these things accumulate, and we address them individually. And 6 weeks later, without question, these patients come in and they say, you have changed my life. And that's why we have such a strong clientele and a huge following. The one thing that can't happen is you can't walk into a doctor's office and get this information in a 4-minute visit. We spend 1, maybe 2 hours with our patients in the first visit. 6 weeks later, it's another 1-hour visit. And we get very comprehensive, in-depth, and we ask these questions. And that's what it takes to get this information from somebody. Now, in terms of validity and how patients are going to address their doctors, you just have to do the research, and you have to have a sort of a gut feeling of what's going on, and you have to really...
Certain people, Dr. Light, certain people like the older generation, and I'll just throw my parents in there right now, don't know where to begin to research. They're not going to take the steps to research. So how about looking at it this way, and Webster, jump in on this, calling a doctor and asking their stance about what? About medication, about a specific medication, and once they find out if it doesn't jive with what we're talking about on the show, find another one? Or do they call someone like you or go to your website, TIFM.com, Texas Institute of Functional Medicine.com for Dr. Light, or CompleteHealthDallas.com for Dr. Webster? But what if they don't live here? People listen to my show all over the world, or all over the United States as well, and, well, that's part of it, but my point is the people living in the United States that are getting this information, what type of doctor do they go to? How do they find someone that has your type of thinking?
There's basically 2 kinds of medicine, and I'm not sitting here impugning all of traditional medicine. Traditional medicine is good if you need surgery, right, or if you need some sort of acute care. If you're dying of a heart attack right now, we've got the best medical system in the world. If you need a kidney transplant, these are things that traditional medicine does very, very well. If you have chronic disease, which is something we address abysmally, then you need to look at the more alternative methods, functional medicine, integrative medicine, alternative medicine options, because traditional medicine has dropped the ball big
So
time.
if someone were to go online and research, they would research functional medicine doctor in whatever the state is.
Yes, it's also called integrative medicine. It's also called alternative medicine.
You want to jump in on that?
Or nutritional medicine.
Or nutritional medicine.
It's often like it's like comparing a firefighter and a carpenter. If your house is on fire, you want the firefighter to put it out. They're very good at that, but you don't want the firefighter to have to rebuild your house. Traditional medicine is like the firefighter. They'll put out the fire in an acute situation. They'll get you out of that extreme danger situation. But if you rely on them to get you healthy, it's just not going to happen. You got to go to the experts in health, and that's the nutritional, integrative, or functional medicine practitioner.
There's a medical doctor who puts people on my cleanses and is a big believer of integrative medicine also. But she has had trouble understanding the importance, and I'm not switching gears here yet, the importance of burst training, okay? And we're not going to get into that right now, but the reason I bring that up is because she's still putting her patients on aerobic type training while they're doing their program, not realizing that when we talk about a chronic condition or chronic inflammation, you're not helping someone by putting them on aerobic training. You're keeping them chronically inflamed and stressed. So from a standpoint of nutrition, what I want to do coming up next is tackle this from a nutritional standpoint, your way of thinking about integrative medicine or functional medicine. What is it someone can do today? What's the takeaway message other than maybe not using statins, maybe looking for a different type of doctor to deal with, and also the takeaway message is, how can I eat today to change my life for tomorrow? Okay. All right, here we go. 752 Sports Radio 1310, The Ticket. Dr. Kevin Light is on the show. Integrative medicine, functional medicine. Also was trained as a traditional doctor for many years. Been a doctor for 25 years. General and trauma surgeon. He's now seen the light, if you will, in that he's looked at what hasn't worked for many years and what's starting to work now. Okay, so he's starting to pass the message along, and that's why he's here today. Dr. Jeremy Webster's here also. Why don't you rifle off some different approaches that people can take to helping their health today? What's the takeaway message, Webster?
All right. In general, for general health, as well as making sure your cholesterol is healthy and your cardiovascular system's healthy, you want to eat foods that are anti-inflammatory. The easiest way to do that is to eat foods straight from the garden and straight from the farm. Not packaged junk food, which I don't even consider food at this point in my opinion.
You know, if you can put something on a shelf in your pantry for 6 months and the bacteria won't eat it, there's a real problem here. Bacteria won't eat it, I'm not eating it either.
Let me just say this real fast. Many medical doctors would agree with you guys, and they're going to say, look, because someone called me on this one time, George, you guys are right. People should eat this way, but all too often patients come into my office and they're not eating this way, so we have to put them on a statin drug. Is this true? You Stoke?
Absolutely not. Number one, your cholesterol level means absolutely nothing.
You just said your cholesterol level means absolutely nothing, medical doctor Kevin Light. Are you serious?
That's correct.
Well, I would disagree with that. If it gets too low, it is dangerous.
Exactly.
There you go.
Exactly. But I'm talking in terms of statin drugs and treatment. You're not going to. The 200 is the magic number. 180 is the magic number. You just need to keep healthy and eat well. But
if people aren't going to be healthy, here's the argument. This other medical doctor said, George, people are coming to my office. They're not healthy. They're not doing anything. We have to put them on a statin drug. Is this true?
Why poison them? Why make the situation worse? Why give them a drug that's going to kill their mitochondria, zap their energy, give them neurological problems, and kill their muscles?
Oh, I love you.
Nice.
So what do you do?
Well,
do you say, look, since you're listening to me, I'm a medical doctor. You're fat. You need to change the way you do this. I'm not putting you on a drug.
You need to enlighten people. The reason people
enlighten them. How about telling them they're fat?
You tell them fat, and you tell them why they're fat. You know, you're eating a bunch of crap. You're eating a high fructose corn syrup. You're eating Fritos. You need to eat food, not junk.
What if they don't do it? I want you guys to answer my question. What if they're not going to do it? A medical doctor's going to say they're not going to eat this way. I have no choice to put them on a statin to make them live longer.
I don't think that's I don't think it's an either-or option. Well, they don't do it, so I'm going to poison them with the drug. I don't think that's
what do they
a
do?
viable alternative.
What's another traditional medical doctor's option? What would you have done 5 years ago if you weren't listening to us?
What would I do 5 years ago? I would say, well, you can lead a horse to water, you can't make him drink, and I've given you the information, and you just have to run with it, and it's your responsibility.
So you still, even 5 years ago, before knowing what you know today, you still would not have put him on a statin drug?
Well, I was a surgeon. And so I wasn't in the statin drug industry.
Okay, that's fair.
But that's the bottom line. It is all about personal responsibility. We have to take control of our own
lives. I know we have to do, but we're not doing it. I'm trying to stick up for the medical doctors who are putting people on the statin drug and saying, look, we don't have another choice. What do we do? I don't want to do that. For people like my parents and other people who are trying, the ones that want the better alternative, they need to search out someone like Dr. Webster or Dr. Light who can give them the better alternative because they have nutritional backgrounds, because of all the extensive research you've done, Dr. Light, post-medical training.
Now I see where you're going with this.
You see where I'm going?
Right. There are nutritional supplements that do have cholesterol-lowering properties. They are even approved. The research is there showing that they will lower cholesterol. I'm not even on board with a lot of these nutritional components. The red yeast rice is one. There's some sterols. There's some certain forms of vitamin E like the tocotrienols. All of these things will lower cholesterol, but I don't even think that's really what we want to do, to tell you the honest truth. I think we want to just eat a good diet, have a good lifestyle, and treat it that way so that our cholesterol is what it is. Our cholesterol is responding to whatever's going on in your body. Going back to some of my next bullets, some of the things we need to do is be able to relieve stress. We need to be active, number one, meaning we need to move around, which most people don't do. And then the second thing is we need to exercise. Being active and exercise, in my mind, are not the same thing.
Agreed.
We need to do both. We need to be active, walk, move, and then we need to exercise very intensely. They have anti-inflammatory properties, and it has anti-stress and cortisol-lowering properties. You know what? You know how you make cortisol? You make it from cholesterol. If you have all this stress and you require all this cortisol production, your liver is going to release extra cholesterol to make the cortisol. So let's relieve some of our stress. Our cholesterol levels will go down automatically.
Dr. Light.
Guaranteed.
Yeah, and the other thing to do is and this is a whole other talk, and we'll get into it maybe sometime, is if you cut out all these simple carbohydrates and sugars that we're eating that are extremely inflammatory in their own right. The cookies, the cakes, the candies, the processed foods, these are extremely inflammatory. They're causing your insulin, which is the drug in your body which sucks up all the carbohydrate. It's a ping pong match with your insulin all day long, and that causes, among other things, increased blood fats and increased cholesterol. And so plaquing. And if you can sort of throttle back on all the sweet stuff that our society just dumps down our population, that would go a long way in controlling that.
Well, again, we're back to, and I'm playing devil's advocate, so you got to stick with me for a moment. We're back to, if you can do this, this is what you need to do. And while I understand that this is the type of show it is, I know there are a lot of people who are listening that don't exercise. They're P1s. They listen to the station all of the time. There's a lot of people who exercise, but they don't eat well. So I don't know that we have the answer today, or if we'll ever have the answer between the three of us. But what is the question is, how do we fix or help someone who doesn't wish to make it a priority to help themselves, and we want to, as medical doctors, keep them alive longer to address their needs? And I don't know that we have the answer.
And I don't think we do. I think they want to believe that the statin drugs are this big helpful thing, but from what I've read and what Dr. Light has read, you know, agree with me or disagree with me, I just don't think there's that much benefit to taking these drugs. And if you really want to take control of your life, you can. Some of the things we've already talked about, some of the things I still want to get to, hopefully we've got a couple points. Detoxification and nutrition. You know, deficiency in a nutrient or excess toxins, either one is going to lead to inflammatory processes, degenerative processes, all those things. So the little bullet points that I mentioned, if you just do those simple things, you got a good handle on your lifestyle.
You have 30 seconds.
I'm done.
Dr. Light, you have 30 seconds. Hit it.
Again, I want to implore people to, the traditional doctor is in a position of power and influence, and I think that they have to realize that a lot of docs don't know what they don't know, and the results are going to start speaking for themselves. The alternative or functional medicine time has come, and I think as we see the improvements in the general population's health with this approach, it'll speak for itself.
Great. Thank you for being here. We're going to have you on more shows because I love your information that you've gotten. Once again, you're a traditionally trained medical doctor who has come over from the dark side, as Dr. Webster said, to not only help people that we've talked to till we're blue in the face, but hopefully the medical community to understand and read some of these books. Give real fast the book. Dr. Ufi Ravskov was the medical, the cholesterol myths. What were the books that you talked about?
The other one was the Ultra Mind Solution, Ultra Metabolism by Dr. Mark Hyman, MD.
Okay, so anything more than that, you guys can email me. I'll give you to Dr. Light.